It started when I was 7 years old and my mum had major heart surgery. And although I wasn't her main carer, I used to do all sorts for her. So yeah, when I look what the actual role of a carer encompasses, it can encompass the small things to the obviously big major day-to-day things. Over the years, my parents had quite poor health, and I was also, from the age of 18, a carer for my uncle. He never married and we still lived with my gran, and he was a paranoid schizophrenic. And believe you me, boy, did he put me through my paces. We had to go through patches where he didn't medicate properly. We had to go and extricate him from shops, local pubs, and sometimes he wouldn't be properly dressed. So that was an interesting scenario. But by and large, everything went quite smoothly, and he was always so trusting of me because I was his only niece. Then we go on to my main caring role when I have my 3 sons. I've got 3 of them. I've got Matthew, who was given a diagnosis of global developmental delay and autism. Right from the word go, we knew there was going to be issues with Matthew, because when he was born, the geneticists had to come and do lots and lots of tests because they thought he had Down syndrome, and he does have all the sort of facial expressions and other sort of characteristics that the lovely Downs people that we have, which in our society. Anyway, he didn't have that extra chromosome, but he unfortunately didn't reach any of his milestones, and as far as I was concerned, I read up on it and I gave him his diagnosis at 18 months, and my health visitor was an absolute, I couldn't have done without her because she backed me up all the way. At the time I had a wonderful paediatrician who is now retired long since, but again, without her encouragement and being such a wonderful person, I don't think I would have got through, because I went on to have Andrew 13 months later, and I didn't suspect anything. He had asthma, and then he was diagnosed with a hip dysplasia at 3 years old, and at that time I had to take, I actually had to finish my job because he needed round-the-clock care because he was in plaster from the waist down. And who else could have performed that role? I mean, we do it naturally as mothers. Mothers are carers, fathers are carers, the whole family are carers, but it was specific. I had to be there for him because I just slide balls underneath and everything, take him to hospital if his plaster was faltering or anything. Then I had wonderful Declan, who is my youngest, and right away I knew there was going to be issues there because Declan didn't reach his milestones. He was quite a happy chappy, but he couldn't talk, and he didn't till he was 4.5. But again, I had the backup of my consultant paediatrician. I had the backup of speech and language, and in those days they were quite good. But I will say to you, and it still prevails today, that there were a lot of things that I had to fight for, diagnosis being one of them. I mean, I think in today's setup, what we find, because obviously as you can see I'm part of Parents in Partnership, we find that a lot of services are quite hard to obtain. Back in my day it was still hard, and it still prevails, and I just feel that it shouldn't, and I think that's what made me join at one point in my life the National Autistic Society. But I've had a very happy association with Parents in Partnership because we do a lot of valuable work. We meet with professionals at all levels. We liaise with parents. We've got our own little office at the hub on the boulevard next to the Adelphi. We hold coffee mornings, we attend meetings, we have our wonderful Disability Information Day, which any of the stall holders here today are more than, we'd be more than happy to see you there. We've just had it back in March of this year. But again, going back to my caring role, I can identify with so much what Sam said. Yes, I could only work part-time. it was an absolute minefield trying to get it all to work, you know, looking after these boys who all had their separate needs. And then I have an older daughter, Lisa. She went on to have her children, and she suffered from postnatal depression. So I then became her carer for a short while, and I had to look after her children as well. And then I realised, and I had to say to Lisa, that Kelsey had a couple of issues going on with her eyes and her behaviours, and she was diagnosed with a squint and ADHD, and she's on medication. But Kelsey was a success story in as much as that, you know, we put a lot into her, and she's now at university at De Montfort doing art and design. But she went and failed her first year, and that's because she was so embarrassed to say that she had a little issue going on. Because it's a proven fact that a lot of people who have autism and some of these disabilities do like to mask it, and I'm afraid us ladies, we're very good at that. We don't want to, you know, let anybody down. So yeah, so it's been when I think about it, I have performed a caring role for most of my life, and I think that's what encouraged me to swap my career from NHS, admin and clerical and secretarial. I worked in local authority for the housing department for many, many years, administrating the disabled facilities grant, to go back to the NHS and have another caring role in rehabilitation, and that was in occupational therapy and physiotherapy. And I'm happy to say now, the job that I did, there is a wonderful unit now at Albion Mill, and if I'd still been working, that would have been my workplace. But unfortunately for me, I now have exactly what Sam touched on in the quiz. I have some disabilities. They're not sort of visible, they're neurological and balance problems and issues like that. So every morning I have a carer who comes to help me wash, dress, shower and everything like that. So I'm now receiving instead of giving, but I still give, and I think I'll probably do it forever. Thank you very much.